Let us also welcome on stage Professor Hua Yi-Yok to deliver a lecture on mindful brain and dementia prevention. Now, this lecture will also mark the launch of the department's new initiative, the Dementia Prevention Program. And as mentioned, Prof. Hua is the recipient of the Tan Gyok Yin Professorship of Psychiatry and Neuroscience at the NUS Department of Psychological Medicine. Prof. Hua received his medical training at the University of Malaya and his postgraduate training in psychiatry at Oxford University and geriatric psychiatry at Harvard University. He has won numerous research prizes and has published over 200 research papers and 21 books on psychiatry, aging, dementia, depression, and addiction. He was the previous head of NUS Department of Psychological Medicine and was also previously CEO and Medical Director of the Institute of Mental Health. So please join me in welcoming Prof. Hua on stage.
Thank you, Ms. Wong. The Dean of Medicine, Professor Yeo Kay Guan, distinguished guests, ladies and gentlemen. Before I begin, I wish to thank the family of the late Madam Tan Gyok Yin for the generous donation to NUS and the department. 10 years ago, 3 professors, namely Chong Pak Yen, Goh Li Gan and I, we met every Tuesday morning at 7 o'clock to discuss 2 issues. One, to rethink the practice of psychotherapy in Singapore, and 2, to plan a dementia prevention program. A central theme of the 2 issues is mental resilience. I shall say a few words about psychotherapy because it forms the framework for the dementia prevention program. My career in psychiatry started in the UK in 1976, some 38 years ago. And my first consultant was a Jewish lady psychiatrist from Vienna, the city of Sigmund Freud. And she taught me techniques of psychoanalysis, and I was given just 1 patient for an hour every Wednesday morning. The following year, the American psychiatrist, Professor Aaron Beck, came to Oxford, and he told us he had a new form of psychotherapy which he called cognitive therapy. Working here in Singapore, we know there is no luxury of time, and time is premium. And so the psychotherapy that we propose is brief. It is also integrative, meaning that not all patients need psychoanalysis or cognitive therapy. And we have to explore different techniques for different patients. In America today, there's a new wave called mindfulness therapy. And this, in fact, originated from India. Here in Singapore, currently, there is a randomized control study on mindfulness for the prevention of dementia and depression over at Jurong, on the west side of the island. And this is probably the first randomized control study on psychotherapy in Asia. It has a very elegant program, and the lead researcher is Professor Rati Mahendran. The outcome is measured not merely with rating scales or neuropsychological tests, but also biological markers like brain imaging, gene expression, cytokines, and also telomeres. We will have to wait for 7 more months before it is finished. And so the psychotherapy that we propose is brief, it is integrative, it is person-centered, and has an Asian orientation. A paper has been published in an international journal, and I was invited to give a presentation at the Royal College of Psychiatrists Annual Congress in London a few years ago. Last week, Professor Chong Pak Yen and Professor Goh Li Gan published a book on brief integrative personal therapy. If you are interested, we are over at table 11. Planning the dementia prevention program was a long and winding road. we encountered headwind, skeptics as well as cynics. People thought that we intend to eradicate dementia like how smallpox was eradicated in Singapore. That's been very naive, even delusional. Currently in Singapore, there are approximately 20,000 cases. And even if we were to reduce by 5%, that's about 1,000 cases. And I think that's a great achievement. So far, the results have been very encouraging. 2 papers have been published in international journals. And last year, a professor from China came to Singapore and visited our center over at Jurong. And he was quite amazed. He told me, how did all of you do such a big, massive study with so little funding from the university? I told him that there are 3 factors, in fact 3 P's. The first P is philanthropy. Without the donation of many of you in this room, this project would never have taken off. In fact, in the beginning, when it was difficult to get funds, and funds were just trickling in, I thought my life would be easier if I were to quit and go into private practice and set up shop in Mount Elizabeth next to Dr. Brian Yeo's clinic. It was my good friend, Professor Goh, who dissuaded me and told me, you know, the old people in Jurong cannot afford your fees in Mount Elizabeth. Prof. Goh is possibly the last socialist in Singapore. An endangered species, by the way. We pressed on and persevered, and many of you responded. One of the donors is tonight somewhere in the audience here, Mr. Lim Ho Ki. He is the chairman of Sing Post, a banker who reads very widely, even medical journals. So last June he read an article in the Lancet Psychiatry, and immediately texted me in his smartphone and said, I'll support the program. Another person is a young man, Mr. Tan Kim Seong, sitting at table 11. Kim Seong owns our favorite Malaysian restaurant in Singapore. It's called Malaysia Boleh. He came up to our center and he was amazed because he told me almost all the people there are volunteers. So it's wonderful when people responded. The second P is partners. We have 2 wonderful partners. The first is the family of the late Lee Kim Tang. They gave us a space slightly smaller than this hall at Jurong Point Mall. The real estate up there is very expensive. They paid for the rental, the renovation, and every year send us a check. Our second partner is the Presbyterian Community Services, who provide the infrastructure support. And I'm very glad the senior management is here, Arthur, Tristan, Lawrence, and David. The third P is people. The program in the Jurong Point has 4 forms of therapies: music, art, mindfulness, and Tai Chi. And all these experts came as volunteers. And no one took any honorarium. A tagline of this program is preventive medicine in the community, by the community, for the community. So by the community includes our therapists, our donors, and also our partners. A couple of years ago, a friend from the World Health, a World Health consultant, came to Singapore, and we discussed this project. And he told me, I can assure you, this project will be a success. And I asked him, what do you mean? He said, well, I see that I see the enthusiasm in the team. Secondly, it is not a top-down approach. He told me, as a World Health consultant, I visit many countries, and sometimes the World Health programs fail because it's a top-down approach without support on the ground. But here, the ground support is wonderful. And also the team, I'm very happy to say that the senior researchers, the research assistants, and our nurses all get along famously. There's mutual respect and trust, which are essential elements of a good team. 2 months ago, I was asked to give a talk to about 70 NMS donors over at the Shangri-La Hotel. At the end of the talk, an elderly lady, a donor, approached me and said, "We are so glad that NUS researchers are now sharing with us the findings. They're so relevant to all of us who are growing older." And she said, well, in the past, the researchers would send their results to some obscure journals, which we don't read, and then they keep the research papers in the department and all will be forgotten. They should remember that the research grants are in fact taxpayers' money. And then she told me, now I'm living on the east side of the island in Katong. Your study is on the west side. How can the people on east benefit from this program? There is now in the offing a plan to roll out the Jurong program to include 3 more centers. So this is in fact translation medicine at its best. We often interpret translation medicine to mean drug discovery. A program that is doing well and benefiting old people in Jurong and is now going to extend it to other districts is also another form of translational research. And in future years, in the audience is one of our researchers, Rose Jiang. She will return to Shanghai. She will obviously bring the program back to Shanghai. Dr. Fen Lei will bring the program back to Shantung and Beijing. So the program will benefit other cities in Singapore. And before I close, I will thank 3 of our early donors. The first is the late Mr. Henry Lim, who was then the president of the Singapore Gerontology Society. He gave us a check of $10,000. By the way, his son, the Member of Parliament, Mr. Raymond Lim, is supposed to be here tonight. He has to go overseas for the assignment. And with the modest sum he gave to us, we did the first study in Singapore on the elderly living alone. One of our researchers, Dr. Lina Lim, published a paper in an international journal. The paper was picked up by a local journalist who wrote a 2-page article in the Straits Times on the elderly living alone, focusing on the poor and the frail elderly. And I've been told that this issue has been discussed at the higher councils of government, and more assistance will be given to that vulnerable group of old people, poor and the frail elderly. So a modest donation by Mr. Henry Lim will impact the lives of a sector of the elderly population who in their youth, like all of us in our youth, have played a role in building this country, this university, this department. The second person is Mr. Lee Soon Teck, the son of the late Lee Kim Ta, who gave us the space over at Jurong Point Mall and also sent us a check. The third person is Dr. Tan Chun Kim, who was previous professor of anatomy. Dr. Tan, who is chairman of the Kuan Yin Temple, sent us a check of $1.8 million. Professor John Wong says, I'm very persuasive. In fact, it's the effort of his son. His son was our medical student some 15 years ago. After finishing medicine, he went to London to read law and is now back as a judge in a state court. And one day he rang me and said, can I sit in your clinic to revise my psychiatry? I said, sure. And because down in the courts, there are many cases of old people with dementia and issues of mental capacity. So during the course of our discussion in the clinic, I told him about the Jurong project, and he approached the committee of the Kuan Yin Temple, and they agreed to give us $1.8 million. And also, there are many people who raise funds for us. And one of them is Dr. Maureen Sakok. Maureen was our previous professor of obstetrics and gynecology. She was also the convener of the NUS Seniors Choir. She wanted a project in Jurong to find out whether if we bring old people together and teach them to sing in the choir, will that promote mental health, prevent depression and dementia? That's a wonderful research question. So a randomized control study will be conducted next year, and the lead researcher is Dr. Fen Lei. Before I step down, I want you to solve a mystery for me. Earlier, outside of the foyer, a donor asked me, is it true you have written a novel which is now used at Harvard University? I told him yes. The novel is called Listening to Letter from America. and it's based on the true story of an elderly Singapore doctor whom I interviewed 15 years ago. He was about 85 years old, almost blind, and he told me he could not watch television, but he enjoyed listening to the BBC radio program called Letter from America by Alistair Cook. And the novel is about many other Singapore elderly who survived the Second World War, the atrocities and brutality of the war. It's a novel about mental resilience. The book was launched about 10 years ago, and I gave a copy to a friend. 4 months later, he sent me a check. When I opened the envelope, I was taken aback. It was for $250,000. It makes the novel the most expensive book in Singapore. I used the money to hire a few researchers from China and also for the Dementia program over at Jurong. When I gave the check to our secretary, Miss Banaja there, she asked me, who is the donor? The donor wants to remain anonymous. However, there is a clue. The anonymous donor is with us tonight. So you will have to figure out whether the person sitting beside you, across the table or the next table, is the anonymous donor. Thank you.
Thank you, Professor Kwok. Now, the Dementia Prevention Program is specifically designed and targeted to address Singapore's rapidly aging population. The program is focused on promoting personal well-being and mental resilience. I'm happy to share that through this fundraising initiative, the department is grateful to have received gifts to set up 3 specific prizes in NUS. And they are the Gold Medal in Psychiatry and Neuroscience, the Keppel Prize in Geriatric Psychiatry, and the Jackie Ng Prize in Child and Adolescent Psychiatry and Maternal Wellness. These prizes will help to recognize academic excellence in the respective fields of study and application. I invite you to refer to the event card on your tables, and you'll find information on ways that you can also support the department. Every single dollar counts towards furthering this meaningful cause. And if you need more information, just please get in touch with the staff of the Department of Psychological Medicine or the NUS Development Office.